Hello, thanks for joining us today. My name is Danny Hames. I'm chair of the NHS Addictions Provider Alliance, and I'm also head of inclusion. We are a provider of community and prison drug and alcohol services across England and are part of the Midlands Partnership NHS Foundation Trust. So I'm here today to talk a bit about the NHS Addictions Provider Alliance, the work we do, and and to tell you a bit more about that. So we're going to cover actually about the NHS APA, what it is, the NHS Addiction Provider Alliance. Going to talk a little bit about our impact so far, and also, if you're interested, how actually to support the APA. So about the APA. Well, we are a collective of 18 NHS trusts working together to be more effective in contributing positively to the addiction treatment sector. So we first formed, I think it was, back in 2015, 2016. It was very much an idea that started, with me and then a few others actually saying how actually as trusts who all provide at that point, drug and alcohol treatment services in the community and prison, how can we work more closely together? And that's actually developed and it's formed. So now we're in 2022, we're now that collective of 18, and we work collaboratively with other stakeholders within the system, and some of those are lifted there. And also what we've done is extended our remit to cover addiction. So that's drug, alcohol, gambling and gaming and treatment support being the most obvious one. Our members are all involved in the provision of those services in one way or another. But what we really aim to do is to collaborate, to act as peers and support each other around our own best practice, to share resources, to share ideas, but also we work together to make a positive contribution to policy and also to practice. So in terms of the development of recent things related to the drug strategy, we've played a key role in facilitating expert to experts and people who provide services primarily. But also we're really involved in actually looking at how we can develop best practice in services. And also we have a real role in advocating for the people who use our services, also the people who don't get to use our services and their family and carers, and actually really arguing that there needs to be adequate resourcing and investment and focus on addictions in England. So our members stretch the length and breadth of England. You can see there's 18 in total, but working in every region of the country. So our impact so far, what have we done? Well, we've had some key campaign work alongside other things we've done, but one of the things we're most proud of was actually a campaign and a piece of work we did, which was really arguing prior to the drug strategy and the independent review of drugs, actually saying that year on year we were seeing more and more NHS inpatient units being lost. So actually the coverage of those units that see those who have the most complex presentations actually need a very highly specialist unit to help them to detox from drugs and or alcohol. We're slowly being lost. I think at one point where we had only 5 left, and currently we still have none in London. I'm happy to say that with the work we've done, and also we're seeing some green shoots in terms of the new investment which has come through the drug strategy, and we now have 7 inpatient units seeing people. But this, we think, was largely and in part to our campaign, which worked across a range of platforms. We used a range of methods. We had a campaign paper. We lobbied policymakers and politicians to get that sort of profile higher. And also have produced a specification for this type of service. So we're really proud of this piece of work, and that links really well into our broader work supporting the work of the independent review of drugs, leveraging and actually getting involvement from across our trust to make a solid contribution to that, and to make the case that we felt needed to be made. And that continues to this day, where we've actually been, a central part of developing new commissioning standards for services. We're actually contributing to work around workforce and so on and so forth. More recently, and there's a sort of a sister presentation to this, but we've now moved on from the inpatient unit campaign, and now we're focusing on the NHS APA Stigma Kills campaign. And this campaign really is a campaign to actually really highlight the the prejudice and discrimination that people who experience addiction themselves or their family and carers often feel, and how actually that can limit their ability to obtain support, to interact with services, and also, really importantly, to actually feel that they should be advocating for themselves and actually doing the things that they need to take them forward and achieve the objectives and outcomes they want to. So, this slide here gives you a flavour of that. We've got a lot of materials and resources we're producing to promote that campaign, and we're really hoping that actually what it does is that people follow the campaign, they support it, that other organisations support it. So, please follow the Stigma Kills hashtag. If you go on the NHS APA website and go to the Stigma tab, you can actually see some of the resources we have available, how you can follow the campaign, how you can support it. And that includes really moving animation, a really great report from a lived experience organisation working with everyone, which consulted, engaged with people who really told some quite at times harrowing stories of their experience of engaging with different parts of our sort of civil society and different institutions within that. It's really worth taking a look at and reading. It's quite an eye-opener. So, the APA, we are generally run on a voluntary basis. We have very limited paid resources. Members from across the trust give their own time to make it work. And we've achieved a huge amount. I've given a flavour of what we've done in regards to that. But one of our other key achievements as well is actually as a collaboration, we're able to successfully bid with Gilead, a life sciences company, as part of the NHS procurement exercise around elimination of Hep C, to create a actual trust-wide projects and the funded project to actually look at micro-eliminating Hep C in NHS APA community drug and alcohol services, and that's taking great strides forward, where we've seen significant increase in testing across our member trusts and actually increasing numbers of people who are actually getting access to medication and recovering, and that on its own is saving lives and improving people's lives. And if we did nothing else, that for me is an illustration of the product of the success of the APA, alongside many of the other things I think we've done. But we need people's support. So the ways that you can support the APA is you could become a member of the APA. NHS organisations, provider organisations can become a member of the APA, but also we have other ways that individuals or non-NHS organisations can look to support us. So please get in touch if you'd be interested in considering that. Obviously, we've talked about supporting the Stigma Kills campaign. Please get behind that. If you go on the website, you can sign up for our newsletter. That's really great to see notifications and to see information about what we're doing. I really would say one of the big things we're working towards at the moment is in November 2022 is our second conference about stigma, with an emphasis on focusing on actually tackling stigma in action, but also looking at how we adjust our language around that. So please sign up and join that. It's a free conference, it's online, so it's very accessible. Last year we had great feedback. We had over 1,000 registrations, 500 people attending, an international audience and international speakers. But you can find out more about that on the website, but also sign up to our newsletter. And that really is just some of the ways you can join and support us. So I hope that gives you a good whistle-stop tour and overview of what the APA is about. We're really pleased about what we've done. We know we can do a lot more. Please join us in that mission. Many thanks.
Hi, I'm Deanne, and I'm in the privileged position of being the lead for the Hep C Later project, and that's what I'm going to tell you about today. So the Hep C Later team is a highly experienced and highly knowledgeable team, all put together to reach one main objective, which is to reach hepatitis C microelimination in the member services that we work with. Hep C Later is an innovative collaboration between the NHS and Gilead, so it's NHS Addiction Providers Alliance and NHS England. So altogether we work with about 15 NHS trusts, and within that there's probably something like 60 services, and they're all across the country. So collaboration is really key with our project. So as I said, we work with multiple NHS trusts, but we also work with lots of different services in the third sector as well. We work across a lot of different operational delivery networks as well. We work with the Hepatitis C Trust, we work with the UK HSA, OHID, NCTMS, and so on and so forth. So we really have to collaborate to reach our main objective. So what do? We support services essentially to do multiple things, such as promote case finding. So, supporting with testing. It could be that we're supporting them with work that helps them to prevent hepatitis C occurring in the first place. We look at how we can complete early intervention work. We look at testing and treatment. We look at using novel forms of testing as well, such as Cepheid machines. We look at developing and enhancing the care pathways that are already in existence in those services. And we look at funding different initiatives as well. So there's lots of innovations that have come out of the Hep C Later project that are absolutely incredible and have reached people in new ways. We look at developing the workforce, so not just for now and to reach our goal, but for the future also. We look at building strong professional networks across the whole entire Hep C community, but across the entire drug sector as well. We're involved in national hepatitis C forums, also local ones. We run our own practitioners forum and put on webinars. We share a lot of best practice and learning and resources. And again, that goes back to that collaboration. We can achieve our goals a lot better if we're actually sharing the resources and the learning that we do have. We've done extensive work with data gathering and cleansing that data and analysing that data to really know where we need to put all of our resources. We've pulled together benchmarking as well, so standards for Hep C care. We work with many promotional campaigns. We're linked in with multiple awareness campaigns and testing events. And we work with service user groups and peer mentors to really reach people in the community where staff may not be able to. And we look at education as well. So really, we're flexible to support the microelimination within those services. So what have we achieved? Well, I can say with pride that we've nearly doubled our testing numbers in the last year. So that's tests that have been done to check for hepatitis C. We've also significantly increased the amount of people successfully completing treatment in the last year. And we've supported with lots of different national initiatives, and we continue to do that work. We've undertaken lots of strategic data work as well that ensures that no one is missed and we're reaching as many people as possible. Our global Twitter reach has grown a huge amount, and Hep C Later, that hashtag is highly recognised hashtag within the country. And we have a number of services that are really close to reaching microelimination as well. So we're incredibly proud of the work that we've done. And all I want to say is, thank you to all of our partners, organisations, the individuals, and for all their commitment towards eliminating hepatitis C.
Okay, my name is Tony Mullaney. I am the Training and Development Coordinator for Hep C Later, part of the Midlands Partnership NHS Trust. And I'm talking today about stigma in hepatitis C. As a person with lived experience, in my teenage years, I was an injecting drug user, and I picked up the Hep C virus at quite a young age, though I didn't know it was the Hep C virus at that time. I was hospitalised. The first time I encountered a stigma was when I was hospitalised in my late teens, early 20s, and I was in a hospital in Birmingham with acute pain in my right side. They admitted me to hospital, and I was in bed in the middle of the night, and a doctor came to my bedside and said, "I want you to leave the hospital." And I said, "Why?" They said, "Because we don't want people like you in the hospital. Could you pack your stuff and get out?" So I was kind of unceremoniously kind of dumped from the hospital that night. And when I got back to my doctors, they'd sent a report saying that I had hepatitis B and hepatitis not A, not B as well. So that was my first encounter with this virus. It wasn't until 1992, on yet another hospital admission due to the consequences of my injecting drug use. I was in a hospital in Birmingham again, and I was in there for some quite severe surgery with open wounds. And while I was in there, they tested me for bloodborne viruses, and I came back as hepatitis C positive. And I was just kind of like casually told by a nurse, do you know you're hep C positive? And kind of, I remember just shrugging my shoulders, like, you know, at that moment in time, it didn't really mean a great deal. But from that moment on, the cleaning staff in the hospital, I was in a side room, refused to clean my room. So nurses had to clean my room and attend to my cleaning needs in that room, wearing full PPE, face masks, gloves, aprons, you know, and I was treated like kind of differently than I was when I first went in there, you know. It's been an ongoing or recurring theme all the way through my life, really. In 1992, after leaving hospital, you know, I was informed that I had the virus, and I went to my local dentist, my family dentist, and thinking it was being a responsible person, I informed the dentist I had hep C. He completed my dental treatment that day, but at the end of the treatment, he said to me, I'm going to close your case here. We don't want you to come back to the surgery again. I don't want to treat you because you're hep C positive. Yeah. And another time in the early 2000s, I had surgery again. Surgery's been an ongoing theme in my life. And I was informed that my surgery would be the last surgery of the day, because they would have to do a thorough deep clean of the surgical equipment in the theatre so as not to infect anyone else. So yeah, so all the way through my life, I've kind of encountered that stigma and that kind of, what would you call it? Discrimination. So yeah, I've been discriminated against because of the status of my bloodborne virus. In 1997, I was referred to with the liver unit to go through hepatitis C treatments, and I was informed at that time I didn't meet the criteria for treatment because I was still an injecting drug user, even though I was on a methadone prescription and wasn't using illicit drugs. I was informed that I didn't meet the criteria. So it wasn't until many years later that I became abstinent myself. I went through a rehabilitation centre and became abstinent, and was again referred in 2007 for hepatitis C treatment. And I went through the old kind of treatment, the interferon treatment, which was quite harsh, but I cleared the virus in 2007. Since then, I've encountered discrimination or kind of been treated differently on several occasions. You know, when I've been to hospital for several other appointments, and when I've had bloods done, I've been informed with a kind of a glance, oh, you're hep C positive, you know. Yeah, so I've encountered it all the way through, and even though I'm now clearing the virus and being a professional in the field, I still encounter that strange look, that sideways glance, you know, when it becomes apparent that I have got hep C antibodies, you know. And even after informing them, oh, I went through treatment and cleared my virus, you know, because I'm antibody positive, the awareness is not there, and they still treat me a little bit different, you know. And as a professional, I've seen it many times. And most recently, I was at a conference last week, and I was asked to speak to one of the Birmingham Hepatitis C Trust's volunteer peers. And he had been sent to London for some maxillofacial surgery recently, and he entered the service. He sat down and he saw a poster on the wall about hep C and bloodborne viruses, and he informed them that he'd had hep C, that he had been through treatment, he'd cleared his virus, and he was working with the Hep C Trust. From that moment on, they all left the room. A doctor came back in and informed him that he would need bloods doing, but he wouldn't. The doctor said, I'm not going to be doing it. He said, I'm going to get someone else to do it because you've got hep C. Then 3 nurses came back in the room with gowns, gloves, face masks and plastic face shields to take his blood. Yeah. Obviously this made him feel very uncomfortable, and he reported that back to his Hep C Trust coordinator, who then asked me to speak to him about it. So it seems that stigma in healthcare settings for people with hepatitis C, even people who've cleared hepatitis C and still are antibody positive, is alive and kicking. And I suppose it's for us as professionals to keep this on our agenda, that stigma kills. Stigma causes isolation, and isolation kills. We will continue with this fight. Thank you.